Hello, and welcome to my presentation on epinephrine autoinjectors. My name is Amanda Howard, and I am a baccalaureate nursing student with Indiana State University. This presentation is intended to help educate people who utilize or take care of a person who utilizes an epinephrine autoinjector, understand how it works, how it is used, and the importance of keeping it with them at all times. After this presentation, the learner will be able to understand what epinephrine is and what it is used for, understand what an epinephrine autoinjector is and what it is used for, have basic knowledge of the different types of epinephrine autoinjectors, have a basic understanding of how to use an epinephrine autoinjector, and have a basic understanding of when to use an epinephrine autoinjector. Please take this time to pause the presentation and test your knowledge of epinephrine autoinjectors with the provided pretest. Epinephrine is a hormone that, when secreted, works by relaxing the muscles in the airways and tightening the blood vessels. This can be important in emergency situations when patients are having trouble breathing or when their blood pressure drops. Here we have pictured a vial of epinephrine that would be used in the medical setting. An epinephrine autoinjector is an automatic injector that contains a single fixed dose of epinephrine. These devices are designed for people who have life-threatening allergies to either foods, medications, or venoms. These devices are intended to be easy to use in an emergency situation. You do not have to be medically trained to use one of these devices. There are many different types of epinephrine autoinjectors on the market available to patients with a prescription. We will cover just 3 of the most commonly prescribed autoinjectors. Probably the most well-known epinephrine autoinjector is the EpiPen. The EpiPen comes in 2 doses based on weight, 0.15 milligrams for small children and 0.3 milligrams for larger children and adults. The EpiPen is generally very easy to use and comes with picture directions on the device itself to assist those in emergency situations. Another commonly prescribed epinephrine autoinjector is the AUVI-Q. AUVI-Q is unique for several reasons. First, it comes in 3 doses based on weight. Like the EpiPen, there's 0.15 milligrams for small children and 0.3 milligrams for larger children and adults. It also comes with a much smaller dose of 0.1 milligrams for babies. The AUVI-Q also talks to you when you open the device, and it gives you directions on how to use it. Another epinephrine autoinjector device is the Adrenaclick. Like the EpiPen, Adrenaclick comes in 2 doses, 0.15 milligrams for small children and 0.3 milligrams for larger children and adults. Adrenaclick is also easy to use, but it can be difficult for children to open. The carry case for this device is a tube that you have to pull apart. While epinephrine autoinjectors are in general easy to use, they can be very intimidating if you have never used one before. All epinephrine autoinjectors have the same basic usage. We'll review this, and then we'll review several different autoinjectors to see how they're used specifically. The first step to utilizing your epinephrine autoinjector is to make sure you carry it with you at all times. You don't know when you'll have an emergency situation, and you can't use your device if you don't have it with you. Every epinephrine autoinjector has its own carrying case. It's very important to familiarize yourself with your case and how it works. Every epinephrine autoinjector has a different mechanism for its case. Every epinephrine autoinjector also has a safety cap or safety caps. It's also important to know where the safety caps are, how to remove them, and which end has the needle in it. You also need to know when to use your autoinjector. This would be when you're having an anaphylactic reaction or if you're having symptoms that could lead to an anaphylactic reaction. You also need to know where to inject your autoinjector and what to do afterwards. You should use your EpiPen if you have had a known exposure to your allergen, or if you have a suspected exposure, you should monitor for signs of an anaphylactic reaction, such as shortness of breath, wheezing, repetitive cough, pale or blue skin, faintness, weak pulse or dizziness, tight or hoarse throat, trouble breathing or swallowing, swelling of the tongues or lips, many hives over the body, widespread redness, repetitive vomiting, severe diarrhea, or just a general feeling that something bad is about to happen. To use an EpiPen or an authorized generic EpiPen, you want to remove the device from its clear carrier tube. You're going to hold the device in your fist with the orange tip pointing downward. You're then going to remove the blue safety cap that is on the top. You're going to hold the device firmly in your hand and you're going to swing it and push it into your outer thigh until you feel the injector click. You will hold the injector in place for 3 seconds to make sure that all of the medicine has injected. You will then remove it from your thigh and seek emergency medical attention. To use an AviQ, you will remove the device from its outer case. Once you remove it from its outer case, it will begin speaking to you. This is particularly helpful for small children and people who have never used a device before, as it gives you very specific directions on how to use it. Once you remove the device from the case, you're going to remove the red safety guard that is on the bottom of the device. Under the red safety guard is a black end of the injector that you're going to place against the outer thigh, and you're going to press it firmly until you hear a click. You will hold the device in place for 5 seconds and then remove it. After this, you will seek emergency medical attention. The AdrenaClick has a 2-part carrier tube that you have to pull apart to reveal the device. Once the device is revealed, you will pull the gray cap off the end that is labeled 1, and then pull off the other gray cap at the end labeled 2. You will place the red injector tip against your outer thigh and press hard until you hear a click. You will hold the device in place for 5 seconds and then remove the injector from your thigh. After this, you will seek emergency medical attention. I have included here some additional resources of epinephrine autoinjectors and how to use them. Please take the time to review these resources and share them with your friends and family so that they can be made aware of how to use your device. Please take this time to pause the presentation and retest your knowledge of epinephrine autoinjectors. I hope that you have enjoyed this presentation, and I hope that you have learned a little more and maybe gained some confidence in how to use your epinephrine autoinjector.